Welcome to Pharmacy Prep. Top 200 cardiovascular drugs, their generic and brand names, clinical uses or clinical indications, and their mechanism of actions. During this presentation, I also like to add few high yield points for these drugs that could be potentially important for your board exams. So let's start. First, start with the cholesterol medications, which is also known as antihyperlipidemics. The most commonly used antihyperlipidemics or the top 200 drugs are statins, which is also known as HMG-CoA reductase inhibitors. Also, the other drugs in this categories are fibrates, also known as fibric acid derivatives, and cholesterol absorption inhibitors, and new class of drugs that is a PCSK9 inhibitors. First, let's start with the HMG-CoA reductase inhibitors. In short, they are known as statins. And here are the drugs such as atorvastatin, brand name is Lipitor; rosuvastatin, brand name is Crestor; simvastatin, Zocor; pravastatin, Pravachol; and lovastatin, Mevacors. All these statins suffix is statin, and they are indicated or clinically used for lowering LDL cholesterols, which is a low density lipoprotein cholesterol. Also, it does helps in lowering total cholesterol and triglyceride, apolipoprotein B, and also total cholesterol HDL ratio, and also slightly increase HDL, which is a good thing. Whereas dyslipidemia conditions, also this is a clinically used and commonly used for reducing cardiovascular disease risk in patients who have long-term diabetes, angina, coronary artery disease, and also stroke. So how this statins work? Statins block hepatic synthesis of cholesterol by inhibiting HMG-CoA. So in the statins works in the liver. In liver, HMG-CoA is a precursor for formation of mevalonate, and then it forms the cholesterol. And this HMG-CoA2 formation to cholesterol is catalyzed by enzyme that is known as HMG-CoA reductase enzyme. And these drugs, they block those enzyme or they inhibit HMG-CoA reductase enzyme. By inhibition, it reduces the formation of cholesterol. However, when the cholesterol is reduced, there is an increase in production of LDL receptors in the cell membranes. And those excessive LDL receptors, which is a high LDL receptor expression, helps in clearance of VLDL and LDL clearance. Thus, the lower LDL cholesterol production and decrease plasma cholesterol as well. And next class of drugs are fibrates. Fibrates, also known as fibric acids, and the fibrate suffix is also fibrate, like fenofibrate. However, gemfibrozil has a different suffix, whereas other fibrates, more than fenofibrates, most of them they end with the fibrate suffix. Unlike statins, statins are the first line therapies for high cholesterol dyslipidemias, whereas fibrates are primarily aimed to lower triglycerides. And also, additionally, it lowers the LDL, ApoB, and also increase HDL cholesterol and ApoA. However, the primary use is added to conditions such as hypertriglyceridemia, which is also known as Fredrickson classification type 4 and 5, who are high triglycerides can increase the risk of pancreatitis. So therefore, those patients will receive combination of fenofibrate with statins. So how fenofibrate's mechanism works? Fibrates basically they are increase the peroxisome proliferator activator receptors, which is present in intracellular, and those PPAR alpha receptors helps in reducing triglycerides and increasing HDL, and also break down fatty acids. So therefore, you have um, more breakdown of the acids. So that means it causes the fatty acid oxidation increases. As a result of that, more fatty acids are broken down. So eventually lower primarily triglyceride, slightly HDL, also does lower LDL as well, however, known for triglycerides. Next class of drugs are cholesterol absorption inhibitors. The best example for cholesterol absorption inhibitor is ezetimibe, brand name Zetia, and ezetimibe is used alone or also used with statins together for those to lower total cholesterol, LDL, ApoB, and triglycerides. So, otherwise, generally, it is combined with the statins because if you understand the mechanism of action, ezetimibe basically selectively inhibited intestinal absorption of cholesterol. So, and also the cholesterol that is coming from the dietary sources such as plant sterols. So there are two major sources of cholesterol in our body. One is 80% of cholesterol comes formed in our body in the liver, whereas 20% of cholesterol taken through the diet or dietary cholesterol. So these drugs primarily target the dietary cholesterol, and the molecular target of ezetimibe is there is a sterol transporter that is called Niemann-Pick C1 like NPC1L1, which is responsible for the intestinal uptake of cholesterol and polysteroids. So, therefore, these drugs inhibit those. As a result of that, it reduces the absorption of cholesterol into the blood circulation. Thus, they lower the cholesterol. Next, the new class of drugs that are called PCSK9 inhibitors. PCSK9 inhibitors are monoclonal antibodies. There are two brands here. One is the alirocumab, and the brand name is Praluent, and avelocumab, which is a Repita, is the brand name for them. So these medications are used in combination with maximum tolerated dose of statin because it is expensive medication, and this also added to those who have higher risk of myocardial infarction, ischemic stroke, unstable angina, or require hospitalization due to the cardiovascular diseases. So these drugs are add-on therapy on top of the statins, aiming for lowering LDL. Here, this PCSK9's mechanism of action, that is fully human monoclonal antibody, which is similar to immunoglobulin IgG1 isotype that binds with high affinity, specifically proprotein convertase subtilisin kexin type 9, which is stand for PCSK9, and as a result of that, it binds to the LDL cholesterol receptors, and it lowers the significant amount of cholesterol, especially LDL. Next class of drugs are high blood pressure medications, also known as antihypertensive drugs. Among those antihypertensive drugs, the most commonly seen drugs classes are ACE inhibitors, also known as angiotensin converting enzyme inhibitors, and angiotensin receptor blockers, and then diuretics, beta blockers, calcium ion channel blockers, and alpha adrenergic blockers. So there are major class of drugs in these categories. First, let's start with ACE inhibitors. ACE inhibitors, short for angiotensin converting enzyme inhibitors, and they all end with the suffix pril, such as benazepril, brand latensin, captopril, lisinopril, brand zestril, ramipril, brand altase, and fosinopril, brand monopril. So, primarily, ACE inhibitors are used for high blood pressure, and also they are first line therapy for heart failure. And also, it is first line therapy for chronic kidney disease, which is also known as CKD, and patients who have a long standing diabetes with nephropathy, and then also prevention of cardiovascular events. So ACE inhibitors works by inhibiting enzyme, that is angiotensin converting enzyme, and which by blocking this enzyme you prevent activation of angiotensin 1 to angiotensin 2. Angiotensin 2 is a strong vasoconstrictor. As a result of that, angiotensin also 2 also has other major functions. It has a sympathomimetic activity and also helps in sodium water retention, increase aldosterone sodium water retention, and also causes vasoconstriction that increase the blood pressure, and also antidiuretic hormone which causes the water retention and more blood volume eventually lead to the high blood pressure. So by blocking this enzyme you prevent formation of angiotensin 2. As a result of that, all those actions of angiotensin 2 are reversed or neutralized. As a result of that, it does cause lower the blood pressure. So angiotensin converting enzyme inhibitors have most common drugs that are widely used for blood pressure. So angiotensin receptor blockers, all their suffix is sartans, like azilsartan, candesartan, losartan, which is the brand is Cozar, valsartan, Dio1. So primarily ARBs, angiotensin receptor blockers, also have the same clinical use as angiotensin converting enzyme inhibitors. So ARBs or angiotensin receptor blockers are used for high blood pressure, heart failure, CKD, diabetic nephropathy, and also prevention of cardiovascular event. So, unlike ACE inhibitors, angiotensin receptor blockers act on angiotensin 1 AT1 receptors, which is present on the angiotensin 2. So, angiotensin 1 receptors are essential for binding with the enzyme, so that way this enzyme catalyzation happens. So by blocking AT1 you prevent binding to those angiotensin converting enzymes binding to the angiotensin 2. By doing so you reduce formation of angiotensin 2, and that eventually helps in lowering blood pressure and also reduce sodium water retention, reduce aldosterone, and also does cause vasodilation. Next, calcium ion channel blockers or calcium channel blockers. There are two types of calcium channel blockers. One is a dihydropyridine type, and then other one is a non-dihydropyridine types. Here, this one is dihydropyridine type of calcium ion channel blockers. Their suffix is dipene, like amlodipine, brand is Norvasc, felodipine, brand is Pelendil, nicardipine brand is Cardine, nifedipine. There are two brands. One is the Procardia and also Adalat. The primary use of dihydropyridines are for high blood pressure and stable angina. So here, these are the sites where dipines bind to the resting inactive state and stabilizes the calcium ion. As a result of that, will not be open for any drug entry into the cell. So by blocking the calcium ion channel blockers, basically dihydropyridine works like a strong vasodilators and by acting via relaxation of vascular smooth muscle cells, and that helps in lowering blood pressure. Next type of calcium ion channel blockers are non-dihydropyridine calcium ion channel blockers. There are two drugs here. One is a diltiazem, brand is Cardiazem, and there are more brands for diltiazem. And verapamil, brand is Callan, and there are more brands for also verapamil available. So, unlike dihydropyridine calcium ion channel blockers, these drugs additionally used for arrhythmic condition, dysrhythmic or arrhythmic conditions, such as they are primarily used for atrial fibrillations and supraventricular tachycardias or cardiac arrhythmias are primary use of these medications. So, unlike the dipene type of calcium ion channel blockers, they also block the calcium ion channel. However, these blocks binds to the open channel, whereas these are resting channels, inactive state. Whereas this one bind to the active state, and then that that by binding to those calcium ion channel, it prevent calcium entry. As a result of that, it causes the vasodilation. However, the primary effect of these two calcium ion channel blockers, such as diltiazem and verapamil, is effect through the cardiac AV node conduction. As a result of that, they do cause bradycardia. So that's a significant difference between verapamil, diltiazem, and also nifedipine or dihydropyridine type of calcium ion channel blockers. So next comes to the cardioselective beta blockers. So among the beta blockers, there are types of beta blockers such as cardioselective beta blocker, non-selective beta blockers, alpha and beta blockers. So first, let's start off with the cardioselective beta blockers. They all beta blockers, they end with the suffix olol, O-L-O-L, olol. Here, cardioselective beta blockers, also known as beta 1 selective beta blockers, they are called acebutolol, atenolol, that is a tenormin, bisoprolol, zibita, esmolol, and then nebivolol. So these are the medication, they are cardioselective beta blockers. And also the most important one is metoprolol, which comes with the two different brand. One is a low pressure and toprolol, which has a different salts. One is a metoprolol succinate salt, and also the other one is metoprolol tartrate salts. Most of the time they are not interchangeable. So here the cardioselective beta blockers primarily used for high blood pressure, stable anginas, cardiac arrhythmias, and for heart failure, only two drugs are used. One is the metoprolol and then bisoprolol. So beta 1 blockers primarily they act on the cardiac beta receptors, beta 1 receptors, thus they lower the heart rate, conduction, and myocardial contractility, which overall helps in lowering blood pressure. Next, non-selective beta blockers, which are beta 1 and 2 blockers, such as propranolol, pindolol, nadolol, timolol, levobenol. They all have a suffix olol, and indications are primarily used for high blood pressure, stable angina. Like propranolol is also used for migraine prophylaxis, and also beta blockers are used for ventricular arrhythmia, especially it is used for tachyarrhythmias. So therefore it is widely used, this medication, for arrhythmic conditions. So non-selective beta blockers have a more than one receptor activities, 1 and 2. So therefore they decrease significantly angiotensin, aldosterone, and cardiac output. And then these medications have significant effect on asthma, so may mask the hypoglycemic side effect. So since they're acting on the beta 1 and 2 receptors, they also act on the vascular bronchial smooth muscle, in the gastrointestinal tract, uterus, liver, and pancreas, because distribution of beta 1 and 2 receptors in all those organs. Next one's called beta 1 and beta 2 alpha 1 blockers. The best examples are labetalol, carvedilol. L- Labetalol is a Trandate brand name, whereas carvedilol brand is Coreg. And all also, of course, suffix is LOL. So they are used for heart failure, especially carvedilol is used for heart failure, and labetalol used for high blood pressure in pregnancy, whereas also it is used IV dosage form in high blood pressure emergencies. Next, beta and alpha mixed blockers. They are basically they work through beta 1 and 2 receptors, and also especially um, carvedilol has antagonistic effect on the alpha 1, whereas alpha 1 they do have blockade and partial agonist activity at beta 2 receptors. So therefore there is a small difference in their specific mechanism of action for carvedilol and then labetalol. Next comes to the thiazide diuretics. Most popular drug in this thiazide diuretics class is hydrochlorothiazide, widely used alone or also comes as a combination with other antihypertensive drugs. So in that, today we're looking at hydrochlorothiazide and chlorthalidone and indapamide. So in this case, thiazides are primarily used for high blood pressure, swelling of the heart in heart failure, and ascites in the chronic liver diseases, and then also swelling due to the renal origin. Therefore, these medications are used for this purpose. Thiazides are primarily works by in the nephron by inhibiting sodium chloride transporters in the proximal part of the distal convoluted tubule, so that decreases the tubular reabsorption of sodium and water, which results into increase in the excretion of sodium and water. So that's a and the site of action is often tested in the exam. That's a distal convoluted tubule. There are several drugs that are available as a combination antihypertensive medications or high blood pressure medications, such as amlodipine with benazepril or lisinopril with hydrochlorothiazide. Brand is Zestrotech. Losartan with hydrochlorothiazide, Hyzar, and valsartan with hydrochlorothiazide DO1, and then amlodipine valsartan X-Forge. So next comes to the alpha 1 adrenergic blockers that all suffix is syn. And however, all sins here, such as doxazosine, prazosin, sildasin, terazosin, alphazosin, they're all not used for blood pressure. Only selected ones, such as prazosin, doxazosine, widely used for creating high blood pressure. Whereas alphazosin, tamsulosin, terazosins are they do use for creating enlarged prostate symptoms such as benign prostatic hyperplasia conditions. So, a high blood pressure is the primary use, and also symptomatic treatment of BPH and acute coronary retention, which is can be caused by those um, BPH conditions. Next comes to the how this alpha blockers works. Alpha blockers are they block the alpha 1 receptors in the arteries, primarily distributed arteries. Alpha 1 receptors in the arteries, they are strong vasoconstrictor. So by blocking these vasoconstrictions, you would enhance the vasodilation. Basically, they cause vasodilation, so therefore they are work like vasodilators. And also, since they do cause severe vasodilation, there is a high risk of low blood pressure, which is also known as hypotension or orthostatic hypotension. And generally, standing position hypertension, blood pressure drops. So therefore, this first dose of medication have to be taken with clinical settings, or take a lower dose. Start with the low dose and gradually increase the dose. Next class of medications are known as mineral corticoid receptor antagonists, which are MRAs. Their most popular drug is spironolactone, brand is allactone, and eplerenone, brand is Inspira. So these medications are very popular because they do prevent calcium, potassium and sodium ion channel. Basically, they antagonize aldosterone, and those aldosterone they compete the binding receptors of aldosterone dependent sodium potassium exchange site, and as a result of that, it does hold the potassium inside the blood. As a result of that, that increase the potassium level. So these type of diuretics they cause hyperkalemia or increase in potassium levels. The next drug is a methyl dopa. The brand is Aldomet. Methyl dopa primarily used for high blood pressure in pregnancy and also in children. So methyl dopa basically metabolizes alpha adrenaline, which stimulates this central alpha adrenergic receptors. So as a result of that, this can be used for pregnancy. So this also helps in basically methyl dopa is a prodrug, and also it does produce alpha methyl norepinephrine or noradrenaline, which stimulate these central alpha adrenergic receptors, eventually reduce the sympathetic tone and total peripheral resistance. Next class of drugs include blood thinners, also known as anticoagulants. The blood thinners include vitamin K antagonists, thromboxane inhibitors, and then factor 10A inhibitors. These three class of drugs, also known as oral or PO, oral anticoagulants. Long time ago, there used to be only one oral anticoagulant, that is vitamin K, warfarin. However, now you have a three class of drugs that is considered as oral anticoagulant therapy. And then you have a low molecular weight heparin, which comes as a injections or subcutaneous injections. Let's talk about the vitamin K antagonist. The drug name is warfarin. Brand can be Coumadin. So they are widely used for treating venous thromboembolism or blood clot prevention or treatment of blood clot in the lungs, that's called pulmonary embolism, and then arterial fibrillation. These are the AFib or commonly used by the vitamin K antagonist, that is a this warfarin. So warfarin works through the vitamin K clotting factors such as um, factor 2, 7, 9, and 10. So these are the factor number 2, 7, 2, 7, uh, 9, and 10. So these are the factors numbers that are often relates to the vitamin K metabolism in the liver, and warfarin blocks that one, and that helps in lowering fibrin formation. So additionally, warfarin also has effect by acting through protein C and protein S, which is a natural anticoagulant present in our body. Next, direct thrombin inhibitors, which is also known as DOACs, which is a direct oral anticoagulant, dabigatran, and also gatran is suffix. Here you have a dabigatran, and which is primarily used for prevention and treatment of venous thromboembolism, and also treatment of pulmonary embolism, and prevention of recurrent deep vein thrombosis, prevention of stroke, systemic embolism in patients with AFib. And there is a mechanism wise, they block the thrombin 2, thrombin, which is a factor 2A. By blocking thrombin, which is a serine protease, which is necessary for fibrin formation, and which is blocked by these drugs, thrombin, which is a factor 2A. Next are the other class of anticoagulant that is known as factor 10A inhibitors. All factor 10A inhibitors are X-band. XA means in the Roman that is the 10. So mechanism is factor 10A inhibitors. So you have a apixaban, rivaroxaban. Apixaban is Eliquis, rivaroxaban is Xarelto, and edoxaban is Savisa, whereas betrixaban is Bevix. So these are factor 10A inhibitors are oral therapies, also primarily used for treatment and prevention for venous thromboembolism, treatment of pulmonary embolism, and also prevention of stroke, and also systemic embolism in patient with atrial fibrillation. So these drugs act through the factor 10A, which is Xabans. That's the site of the action of these class of drugs. So it is a basically a direct, selective, direct antithrombin independent factor 10A. That's important to know about these drugs. Next, other types of anticoagulants are low molecular weight heparins. All low molecular weight heparins suffix is parin, and enoxaparin, dalteparin, tinazaparin. Enoxaparin brand is Lovenox, dalteparin is Fragmin, tinzaparin is Inohep. So these low molecular weight heparins primarily used for prophylaxis and treatment as venous thromboembolism and treatment of deep vein thrombosis and treatment of unstable angina and acute STEMI. And these drugs also act between factor 2 and factor 10. So that's a very important thing here. So low molecular weight heparin, slightly smaller size than the heparin. So therefore, they have more selectivity to factor 2A and less selectivity to factor 10. So therefore, I'm confident these points are very potential for the exams, and they test you often questions like low molecular weight heparins such as enoxaparin has more effect on thrombin, less effect on uh, this factor 10A. So therefore, as a result of that, they have less ability to accelerate inactivation of thrombin factor 2A, but they do have ability to catalyze inhibition of factor 10A. So next comes to the other class of drug, that is the antiplatelets. Antiplatelets, the most popular one is low dose acetyl salicylic acid, P2Y12 inhibitors. These two are major classes. So acetyl salicylic acid, also known as brand aspirin, generally low doses used for cardioprotection, such as 80 milligrams to 300 milligrams dose commonly used, or 160 milligram is used for treating cardiovascular complication preventions. So acetyl salicylic acid, basically, it is also used for treatment of transient ischemic attacks, ischemic stroke, acute stroke prevention, and post MI. It is often combined with the dual antiplatelet, also known as DAPT. DAPT is a dual antiplatelet therapy, which is combined with other um, aspirin, other drugs such as clopidogrel, that is known as DAPT, which is a dual antiplatelet therapy. All right, so next comes to the here is the mechanism of action for aspirin. Aspirin mechanism of action is the most commonly tested question in the exam or frequently asked about mechanism because it has irreversible platelet inhibitors. So it does bind to the cyclooxygenase by acetylation, and because of that acetylation, it does permanently inactivate the COX enzymes through through covalent acetylation of COX enzyme. As a result of that, it does have a at least 7 to 10 days antiplatelet effect because of the complete uh, irreversible platelet inhibition effect. Then comes to the other drugs, that is the P2Y12 inhibitors. Their suffix is a grel, like clopidogrel, the brand is Plavix, prasugrel, brand Efficient, ticagrelor, Brilinta, which is the brands. So B2Y12 inhibitors, similar to aspirin, they are used for secondary prevention of atherothrombotic events such as MI, stroke, vascular death, and also people who have a documented strokes and infections. And also this is combined with the DAPT dual antiplatelet therapy using by acetyl salicylic acid or aspirin. So these drugs are basically they block the P2Y12 activity, which is ADH bind to this place, and it is blocked by these drugs. So therefore, that reduce the activation of platelet and that prevent the platelet aggregation, and that helps in lowering platelet activity. So basically, this also bind to the ADP. ADP receptors are here, and ADP receptors are P2Y12s, and they do prevent activation of platelet aggregation. Next, we have antiarrhythmic drugs, which is a irregular heartbeat treatments. Among the antiarrhythmic drugs, which is a most commonly used drug, is amiodarone. Amiodarone brand is Cordarone, which is used for treatment of life-threatening recurrent ventricular arrhythmias when they are not responded or documented adequate dose of other antiarrhythmics, and also hemodynamically unstable ventricular tachycardias and recurrent ventricular fibrillations. So amiodarone has more than one activity, although it is grouped into class 3, but it does have a one activity, which is a sodium blockade as well, and then also it blocked the drug 2, which is a class 2, which is a calcium ion channel entry, also blocked by this one. And then also it exerts the antisympathetic activity, and primary effect is coming from class 3. That's the main effect of this drug comes from class 3. And additionally, other drugs in this category include vasodilators. Vasodilators are hydralazine, brand is aprisolene, and like other vasodilators, these direct vasodilators, they are primarily used for high blood pressure, and also they comes in IV. So therefore, it is used in hypertensive emergencies in pregnancy, and also can be used in heart failure along with isosorbide dinitrate or nitrates for patients who cannot tolerate ACE inhibitors or ARBs. So hydralazine has a direct vasodilatory effect that lead to the peripheral resistance, reduce the peripheral resistance. So the effect is greater in arteries than veins. So therefore, reduction in diastolic than systolic pressure produces little orthostatic hypotension. So next, last class of the drugs in this cardiovascular drug categories, isosorbide mononitrates brand is Imedur, and nitroglycerin brand is Nitrostat, and they have a nitrate suffix. So they are primarily used for prevention of angina pectoris due to the CAD or coronary artery disease, and also combined with hydralazine in heart failure patient. So nitrates they function by the nitrates are prodrugs, and they become dinitrated to exert therapeutic effect. And denitration liberates nitric oxide, and that nitric oxide activate the guanylyl cyclase, and then eventually it comes to the guanosine monophosphate, which causes the vasodilation. So, in addition to relaxation of vascular muscle, these drugs also relax bronchial, biliary, gastrointestinal, and urethral and uterine smooth muscles as well. All right, with this information, stay tuned for more drugs and their generic brand name, and then clinical uses or indications, and also their mechanism of action. Stay tuned for endocrine disorders, drugs, and also CNS drugs upcoming for videos. Until then, subscribe and thank you.